This is Beijing in mid-December. Funeral vehicles are lining up one after another, filled with people who have just passed away. Now, these vehicles have been lined up to Chang'an Street, a major thoroughfare in Beijing. These vehicles are for storing bodies. Talking about cremation, if there was nowhere to store the body, how is cremation possible? Look at these vehicles. They started lining up yesterday. Anyway, now there is a queue every day. Even so, they don't always make it to the cremation on the same day. Starting December 7th, China gradually lifted its dynamic zero-COVID policy that had been in place for 3 years. The sudden relaxation of the extreme epidemic control measures without warning, preparation, or planning has led to a spike in epidemic and a fear of a medicine shortage. It soon drowned out people's cheers for the long-awaited lifting of the lockdown. Hospitals everywhere are overwhelmed with patients. Fever medicine is snapped up, funeral homes are full and hard to access, and people are panicking. This is Wuhan, a hospital with a lot of people outside the outpatient department getting an IV. Some of them are sitting in their vehicles. Despite the cold winter, there are so many people with IVs that they have to sit at the entrance of the hospital.
This is the 5th store I've been to, and all 3 medicines aren't available. Look at this way. Medicines are bought by one person. He bought them all. This is the price. The pharmacy uses it to increase its revenue. I just went downstairs to buy some medicine. The staff told me it was to lower the fever. The price tag has been changed several times. The top label was 35 RMB or US $5, and the bottom one was 25 RMB or US $3.6. And there is more. They raised the price of medicine and profit from the national disaster. It was initially sold for 15 RMB or US $2.1.
On December 11th, the number of fever clinic visits in Beijing reached 22,000, a 16-fold increase from a week earlier. Calls to Beijing's 120 emergency hotline exploded, with daily call volume reaching more than 30,000, 6 times the usual.
This is the fever clinic at Cowling Hospital. They are all fever patients lining up. I'm telling you, there's no place in line for me. This line is all queued up to nowhere. Look, they're all feverish. So many people. There's no way I can get a turn. I can't even see the end of the line.
I'm worried. I'm definitely worried that I'll be infected too, because after all, the virus is spreading so fast, especially now that the whole country has already opened up. I'm afraid that I'll also get sick. As for medicine, you need to buy some cold medicine, but if you really do get infected, it seems that the usual fever medicine doesn't really work. I've already prepared supplies of medicine in advance at home, so I don't need to join the queues at the pharmacies to buy medicine. Now, if you want to buy medicine, you have to queue up at the pharmacy. There are so many people. There are indeed a lot of positive COVID-19 cases now. Basically, if you have a cold, then you're positive. When you test yourself at home, you're also positive. I also tested positive before, but after staying at home for a few days, taking some medicine, and drinking a lot of water, after 2 or 3 days, you'll test negative. It's not a big problem.
也没啥太大问题。
According to some big data experts, December 17th was the date when the first wave of the outbreak hit Beijing at its peak. It was estimated that about 35% of Beijing's population should already be infected. Based on the 22 million people living in Beijing, it means that at least 7.7 million people in Beijing have been infected. Naturally, you can hardly see this phenomena in the official data released by China. On December 17th, the Chinese Healthcare Commission published data on 428 confirmed cases in Beijing.
I feel very detached from the current situation. Yesterday, my colleague told me why the government is still reporting on the case numbers and surges, and how many thousands of cases there were, and so on. It's too far from reality. I don't think it's necessary to report it anymore.
A former deputy director of the Chinese Center for Disease Control and Prevention told China media that up to 60% of China's population could be infected in the first massive wave. Eventually, about 80 to 90% of the population will be infected. That means more than 1 billion people will be infected with the virus. The head of the World Health Organization's emergency program revealed on December 15th that the number of confirmed cases had exploded long before China loosened its zero-COVID policy, because prevention and control measures by themselves didn't prevent the disease from happening. An anonymous source told overseas Chinese media that the Communist Party's top brass abandoned the zero-COVID policy as early as December 7th, because on the one hand, people had started a white paper movement in more than 20 cities to protest the harsh policy, and on the other hand, the epidemic in Beijing could no longer be covered up. Instead of letting the public see that as the capital city, the zero-COVID prevention and control measures were failing, it was better just to let it go and put the blame for the massive outbreak on the people who demanded freedom. But the real issue is rooted in the hospitals. This is an internal recording from a private hospital in Beijing, and it somewhat validates these claims.
Many hospitals are actually paralyzed. Yesterday, December 11th at 4 p.m., Beijing recruited all retired healthcare workers to return to their posts, and Guangzhou is also doing this. So the first wave is very serious, and it looks very different from what we thought. It's not that the virus is lying flat, it's actually just starting. Why did the US dare to open it in July? It's because it did a lot of national preparation in the early stage, and every family was prepared for the oxygen machine. People wouldn't come to the hospital unless their sickness reached a certain level. It greatly reduced the number of visits to the hospital. Unlike us, people come to the hospital in the first wave and overwhelm all medical resources. What follows is that we aren't able to provide any treatment at all, so the deaths are caused by this medical overcrowding.
Professor Ben Cowling, an epidemic expert, told NPR that the epidemic is now spreading faster in China than anywhere else in the world during the pandemic. In epidemiology, scientists use an R value to measure how many people on average are infected by a single patient. Cowling said at the start of the pandemic in early 2020, the R value was about 2 or 3. During last winter's surge of Omicron in the US, the R value jumped to about 10 or 11. Scientists at the Chinese National Health Council estimate that in this outbreak in China, the R value is as high as 16, spreading faster than previous outbreaks around the world, Cowling said. That's why China can't continue with its zero policy. The virus is also too transmissible for them. Professor Cowling added that the Chinese had very little immunity to the virus because the vast majority of people had never been infected. Until recently, the CCP had focused on mass quarantine, testing, and travel restrictions to keep the vast majority of the virus out. This has prevented most people from contracting the variants that appeared before Omicron. But it means that almost all 1.4 billion people are now vulnerable to infection. The Chinese government's massive 3-year zero-COVID project was reduced to nothing. China's fragile healthcare system is in for a big test after having to abandon the lockdown. The Communist Party's official media, People's Daily, cited data from the State Council experts on epidemic prevention and control in November this year, saying that China has 6.7 medical beds per 1,000 population and less than 4 critical care beds per 100,000 people. According to the Organization for Economic Cooperation and Development, the number of ICU critical care beds per 100,000 people in 2020 is 28.2 in Germany, 21.6 in the US, and 13.8 in Japan. In addition to the scarce number of doctors per capita, China's healthcare resources are unevenly distributed. For the approximately 500 million Chinese living in rural areas, access to doctors and hospital beds is much lower than in urban areas. In rural China, there are fewer than 2 doctors and nurses combined for every 1,000 people. In contrast, there are more than 5 doctors per 1,000 people in Beijing and Shanghai. Despite government propaganda that the pharmaceutical industry is struggling to produce, this is a reflection of just how far China's medical resources have fallen short of what is needed today. At present, raw materials and preparations have been produced at full capacity. We will also organize the production and coordinate between production enterprises, medical institutions, and commercial circulation, among others, scientifically and accurately organize the delivery of medicines and improve the accessibility to medicines for the people. China's elderly are at the greatest risk. Within a month or so before and after December 7th, universities like the renowned Peking University and Tsinghua University in Beijing have published successive obituaries of 33 retired elderly professors. A person working in the Beijing crematorium indicated that nowadays, even if an appointment was made 5 days in advance for cremation, it is not always possible to get a place.
Now this is really the case. Funeral homes are full, outside storage is full, the morgue is full. We are worried. There's no place to deposit bodies. I discussed with my colleagues one night that there isn't even a place to store the bodies. Why all of a sudden so many people have passed away? Now we're burning them from 7:30 a.m. to 4:30 p.m., but can't finish burning them, and the freezer is full, so we can't store them anymore. The funeral director has told others not to send any more bodies here. It's at its capacity. I can't keep up, and even booking a cremation 5 days in advance becomes impossible. Really crazy. You send this information to Douyin so that the relevant government branches can do something about it. What's the situation now? Whoever passes away because of being positive certainly can't admit it. This batch of death is all related to the new coronavirus. Most of the deceased are over 70 years old, 80 years old, some with chronic illnesses. It's all people like that.
Some sources claim that families of people who die of COVID-19 in Beijing need to choose whether it's COVID or pneumonia in the cause of death column. If they choose COVID-19, the morgue and crematorium may reject the body. Then the family would have to choose pneumonia, which wouldn't be counted in the epidemic's death toll. Beijing at present looks like a city under the plight of lockdown control. Restaurants and entertainment venues along the streets are closed with little traffic. What were once busy streets are now empty. People are hiding in their homes and stocking up on medication. Hospitals are overflowing with patients, and too many staff members have been infected with the virus and are unable to work. This round of outbreak has practically covered the entire country, except that Beijing is the one that leads the way. As it's the capital city, it has received the most attention. Those who have also been hit hard include Shanghai, Guangzhou, and several major metropolises. Because of a shortage of doctors and nurses, healthcare workers in hospitals around the country have to work with illness. This is a hospital in Guangzhou where some doctors are seeing patients while getting IV fluids. The Chinese government has announced that many fever clinics have been opened across the country as a matter of urgency. According to our statistics, as of December 14th, more than 14,000 fever clinics have been opened up in hospitals above the second level nationwide. More than 33,000 fever clinics have been set up in community healthcare institutions. In addition to increasing the number of fever clinics or fever rooms, we have also further simplified the process of visiting fever clinics. But apparently, it's not nearly enough. For those who are still alive, the most important thing is to be prepared with medicines in addition to self-protection. In this regard, there are people who have encountered unexpected difficulties because medicines are now too valuable. My wife is pregnant and the hospital said she could only take Tylenol. This woman told me she had none in the store. But what happened was that I sneaked in when they opened the door. Come, take a look, my friends. Look how many medicines there are here. It's all Tylenol. I begged her, please, please sell me a box. My wife is positive and has a fever. She told me she didn't know the price. Come on, she told me she didn't know the price. Come, look, the price is clearly labeled. They just won't sell it. I don't know what's their intention. They just don't sell them. For officials working inside the government, did they know that the current wave of the epidemic would arrive on such a large scale? Are they prepared to handle it? Evidence suggests they know and are prepared. A document from the city of Wuxi in Jiangsu province seems to have leaked such a state secret. On December 6, screenshots of alleged system insiders showed that the Wuxi municipal government met to convey the news that the city was criticized by the Jiangsu provincial government for being too slow in making the population positive, and that the economy would be ready to return to normal operation in time for March 2023, when most people have been infected once. The Wuxi Education Bureau has requested that students with positive nucleic acid tests for 2 consecutive days return home, while all other students attend classes normally. This positive doesn't include self-made tests or one positive nucleic acid test, which means that students who are positive for nucleic acid tests only once aren't considered positive and need to continue attending classes. Why is it necessary to make all residents positive once before March? It's because next March the CCP will hold its 2 sessions, the National People's Congress and the Chinese People's Political Consultative Conference. It can be said that the municipal governments are now intentionally putting out the virus so that children and adults can be infected as soon as possible. And those who survive will have completed the immunity cycle by next March. Governments around China are now racing to see which cities have more positive cases or faster growth. It isn't clear whether indicators of the job performance of government officials are linked to this. There is also a so-called scientific affirmation from Chinese epidemic prevention experts. A known scholar, Zhangnan Shen, said on December 15th at the National University's anti-epidemic lecture that after infection with Omicron, there is a very small percentage of infection within a year, which is equivalent to a vaccination. But other research firms aren't as optimistic as the experts. According to the Macroeconomic Advisory Group, Wigram Capital Advisors, an unprecedented winter wave of COVID-19 outbreaks could occur after the CCP lifted its COVID-0 policy, with daily deaths as high as 20,000 by mid-March 2023. By late March, demand for intensive care units would peak at 10 times capacity with 70,000 daily admissions. Some Chinese had planned to take advantage of the unblocked border to rush out of China. Yet, even that chance is getting increasingly slim, with the US and German embassies in China announcing on December 15th and 16th respectively the complete suspension of all regular visa services. It's expected that other Western embassies and consulates will follow suit. John Kirby, the White House National Security spokesperson, made a statement on December 14th that if Beijing requests assistance, the US is prepared to help China deal with the ongoing wave of new coronavirus outbreaks. He said, "We have made that point that we are prepared to help in any way they might find acceptable. That was true back when the pandemic was raging, and that is true today." But there has been no request from Beijing except for an agreement signed by Chinese pharmaceutical companies on the 14th with US drug maker Pfizer Incorporated to import and distribute its oral drug Paxlovid for COVID-19 in mainland China in response to a surge in positive patients in China after lifting the lockdown. Given the American offer, on the following day, a Chinese Foreign Ministry spokesman said that China has a systemic superiority in the face of the outbreak.
目前药品和检测试剂正在加
We are ramping up the production of medicines and test kits. Overall, this can fulfill the nation's needs. Currently, more than 90% of people in China have been vaccinated. This is considered a high level in the world. We have institutional advantages. We will certainly be able to smoothly get through the peak of the pandemic.
一定能平稳度过疫情高峰。
In the eyes of the CCP, once it accepts American assistance or expert advice, it is tantamount to losing the battle between the Chinese and American systems and the ability to govern.